Published 1915 EDT, 1 November 2017. Updated 1918 EDT, 1 November 2017. Dentists are inventing patients and billing the NHS for work that was never done, health officials have warned. Along with false claims by patients, the scam is helping fuel fraud that is costing the health service nearly £1.3 billion a year. The head of the new NHS Counter-Fraud Authority revealed yesterday that bogus claims by dentists are estimated at £121 million a year, £70 million of it for non-existent work. The head of the new NHS Counter-Fraud Authority revealed yesterday that bogus claims by dentists are estimated at £121 million a year, £70 million of it for non-existent work. Cheating GPs are estimated to cost £81 million, while NHS payroll and identity fraud account for £91 million. Patients falsely claim £397 million a year for exemptions for dental fees and prescription charges. The authority promised to investigate without fear or favour to protect the NHS from the despicable actions. The estimates are the first to assess the scale of losses across the health service. The sums, which represent about 1% of the NHS budget, could have paid for more than 40,000 staff nurses, or 5,000 ambulances. The launch of the new authority yesterday follows warnings of a steep drop in successful prosecutions, with only 91 in 201,516, compared with 393 in 201,011. Cheating GPs are estimated to cost £81 million, while NHS payroll and identity fraud account for £91 million. Sue Frith, head of the agency, has promised to crack down on fraud committed by professionals and patients in order to protect the honest majority. She said the actions of individuals were diverting large sums from the public. People may think it's just a small amount, but in large volumes it adds up and has an impact. She said, "It is criminal behavior. It is despicable. People would even claim things they are not entitled to. This is money that should be spent on frontline patient care." Scams against GP practices and dentists, where a fraudster poses as a regular supplier and tricks the business into paying them, will also be targeted by the agency, which will be independent and focus solely on fraud. Its predecessor, NHS Protect, covered security as well. Responsibility for this has now been devolved to local NHS trusts. The budget for tackling fraud has been increased by over 10%. This will allow more field officers to be appointed to gather evidence and a greater focus on fraud prevention by reviewing contracts and safeguard systems. Health Minister Lord O'Shaughnessy said the crackdown was the first example of an NHS organisation dedicated to tackling health service fraud and corruption and bringing fraudsters to justice. He added, fraud in the healthcare system not only undermines public confidence in the NHS but also diverts valuable resources away from caring for patients. The British Dental Association's chair of general dental practice called for more clarity on how to claim for treatment. Henrik Overgaard Nielsen said, "We condemn any action that takes resources away from our patients. Genuine fraud must be exposed, but we are working under a discredited contract system that breeds confusion. Put 10 NHS dentists in a room and you'll get nearly half a dozen different views on how to claim for a treatment. It's an insane system, and not even officials can navigate the grey areas." For over a decade this model has failed patients and practitioners alike, and we need ministers to honour their pledges and deliver real clarity. 2 years ago a dentist was jailed for claiming payments totalling £780,000 for work that was never carried out. Jayanti Lulbika by Mystery, 67, from Willesden, northwest London, was sent to prison for 3 years. Between 1997 and 2013 he routinely invented fictitious patients and forged signatures. In one case the address he had given as that of a patient in fact belonged to a branch of a bank. Further inquiries found almost 300 addresses of patients that Mystery used did not exist.